All right, welcome back to our final lecture for electrical stimulation. In this lecture, we're going to combine medication administration, we're going to look at tissue healing, and then we're going to finally discuss some of the contraindications associated with E-Stim, and we'll kind of get a little bit of an introduction into billing codes and those types of things as well. Okay, so let's talk about iontophoresis and how it works and maybe some of the key considerations to think about here. So iontophoresis is a non-invasive electrical stimulation technique used to deliver medications transdermally, meaning through the skin. It utilizes a direct current to drive ionized medication into the target tissue. And something that we need to think about, key principle, is that the polarity of the current must match the charge of the medication to ensure effective delivery. So if you think about like magnets, right? If you have one that attracts to another, it's going to, like if you put a magnet on the fridge, those typically have some kind of different charge so that it actually is attracted to that, whatever material your refrigerator is. For iontophoresis, we want the polarity and the medication to be the same so that it actually drives the tissue deep into, or I'm sorry, it drives the medication deep into the tissue. So like a positive current with a positive type medication or something along those lines. Okay, so typically the effective penetration depth is about 1 to 2 centimeters, making this method ideal for treating localized areas of inflammation, pain, or soft tissue dysfunction. Some of the common medications that are commonly used with iontophoresis includes dexamethasone, which is a negative charge for inflammation, and lidocaine, which is a positive charge for pain relief. And we'll look at some of those other medications here in a second. In clinical practice, iontophoresis can be an excellent alternative to oral or injected medications, reducing systemic effects while providing targeted relief. However, proper patient screening, skin assessment, and correct dosage settings are crucial for safe and effective treatments. So when using iontophoresis, it's essential to understand the key parameters that influence treatment effectiveness and patient comfort. So let's break down these parameters. So let's look at the waveform first. Iontophoresis uses a continuous direct current to ensure a constant unidirectional flow of electrical charge. This is necessary for pushing ionized medication through the skin. And then we look at the polarity. The polarity of the electrode must match the charge of the medication to facilitate proper medication delivery. For example, dexamethasone, which is a negative charge, requires a negative electrode, while lidocaine, a positive charge, requires a positive electrode. Then we go down to the intensity. This is typically set between 1 and 4 milliamps and is adjusted based on the patient comfort to prevent irritation or burns. Lower intensities are often better tolerated for longer durations. Okay, now let's look at the dosage. So this is measured in milliamp minutes with a typical range of 40 to 80 milliamp minutes. So example, if you're using 2 milliamps for 20 minutes, the total dosage is 40 milliamp minutes. And maybe we'll go over some more of those examples in class. And then we look at the electrode placement. So the active electrode, the one that contains the medication, is placed over the target treatment site. And then we have the disperse electrode, which is the one without the medication. That electrode is placed several inches away to complete the electrical current and allow for a safe current flow. So understanding these parameters ensures that iontophoresis is effective, safe, and comfortable for your patients. And remember that it's a great alternative for localized drug delivery without the need for injections or systemic medication effects. So this is a slide that I would definitely star if I were you, because these are the medications that you're going to have to know for any quizzes in the future, okay? So let's look at some of these medications, their charge, and their purpose. So the first one that we see is dexamethasone. This is one that we've talked about already. we can see that it has a negative charge. And the purpose of this medication, it's an anti-inflammatory. So common uses, it's going to treat inflammation, often used for conditions like tendinitis or bursitis. Just remember that that negative electrode is used to drive the negatively charged dexamethasone into the tissue. Then we go to lidocaine, which is a positive charge. So this is a local anesthetic and commonly used to provide pain relief, either by numbing the targeted area or reducing pain, and commonly used in musculoskeletal conditions. So remember again, the electrode placement, the positive electrode is used to push lidocaine into the skin. Then we go to calcium chloride, which is a negative charge. This helps to reduce scar tissue and keloid formations. So this typically helps to soften scar tissue, maybe even reduce muscle spasms some. And it's, again, that negative electrode there. For zinc oxide, this one is a positive charge. This one is used to help with healing of dermal ulcers and wounds, so used in wound healing and tissue repair. And remember, again, positive charge there. Last two on the list, we have acetic acid, which is a negative charge. This helps to break down calcific deposits, typically treats calcific tendinitis and myositis ossificans by helping dissolve calcium deposits. Negative electrode placement. Last one here is magnesium sulfate, which is a positive charge, used to reduce muscle spasms and to improve blood flow to areas. So we're using this for muscle relaxation, to increase circulation in areas with ischemia. And remember, again, positive charge here. So again, some of the key takeaways: always match the polarity of the medication to the appropriate electrode for effective delivery. Negative charge medications go with the cathode. Positive charge medications go with the anode. So again, remember, these are the medications that you're going to be responsible for knowing for any quiz material. So that's iontophoresis. We're going to start getting into tissue healing with electrical stimulation now. So the main modality that we're going to discuss with tissue healing related to electrical stimulation is something that we call high volt pulsed current. So forgive my misspelling of that pulsed up at the top there. But high volt pulse current is a monophasic pulse current that is commonly used in wound healing due to its ability to enhance tissue repair and to reduce bacterial growth. This is achieved through a process known as galvanotaxis, where the electrical charge influences cell movement to promote healing. So let's look at some of the polarity effects in HVPC. So when we have a negative polarity, we're going to use this negative polarity to attract fibroblasts and neutrophils, which are essential for tissue repair, like we saw in our earlier lectures. And is often used during active infection to help facilitate and fight off bacteria. Then we go to the positive polarity. So when we're using a positive polarity, we are trying to repel bacteria and promote epithelial cell migration, making it beneficial for later stages of wound healing. So this can be switched to positive polarity once the infection is under control and optimize re-epithelialization. As far as the electrode placement goes, the active electrode, either positive or negative, depending on the treatment goal, which is something that you'll choose on the machine, is placed directly over the wound site or just distal to that. The dispersive electrode is placed proximally to complete the flow and allow proper current flow. So why are we going to use HVPC? We're going to help manage chronic wounds, pressure ulcers, diabetic foot ulcers, post-surgical incisions, and this is going to help provide more of a non-invasive approach to wound care that complements traditional wound management strategies. So we kind of just talked about some of the indications and when we would use this. We also discussed galvanotaxis, which is something that you're going to need to know as far as quizzing and materials go as to why HVPC works so well. So refamiliarize yourself with that term, galvanotaxis. And then we're going to look here at these parameters. Okay, so I created this nice table here for you that discusses some possible indications or presentations that you might see with your patient. So depending on the presentation of your patient, you're going to choose the polarity, either positive or negative. So let's look at some of these different cases. So if you look at the left-hand side, we're going to start with tissue healing, inflammatory phase, active infection. So if that is the case, we're going to use a negative polarity, and then we're going to choose a pulse frequency of 100 to 105 pulses per second. The pulse duration is typically going to be preset at around 100 microseconds, and we're only trying to stimulate a sensory feeling with this particular setup of HVPC. So just remember the amplitude is the intensity. So only sensory for tissue healing in the inflammatory phase or if there's an active infection. Let's go to the next one here. So we're still thinking of tissue healing, but now we're in the proliferation phase. So there's no infection or anything like that. We're going to choose a positive polarity. Our pulse frequency is going to be the same as well as our pulse duration. And we're still only trying to induce a sensory input for our patients. So the only thing that really switches here is the polarity. So let's look at the next one here, edema with inflammation. So we're going to choose a negative polarity here, and we're going to change the pulse frequency up to about 120 pulses per second. The pulse duration is going to be preset anywhere from 40 to 100 microseconds. And the amplitude is about 10% below the motor threshold, which basically means you're getting it very close to where you might see a contraction, and then you're going to turn the intensity down just so you do not actually see that contraction. So you still don't want to see any type of muscle twitch or anything like that in this phase here, but you're getting close to that threshold. Okay. And then the last one, we have edema with lack of motion. So polarity could be either positive or negative. As far as the pulse frequency goes, 35 to 50 pulses per second. And we're going to set an on-off cycle for this one at 1 to 1. So it could be 10 seconds on, 10 seconds off. The pulse duration is going to be set anywhere from 150 to 350 microseconds. And we're trying to get a visible contraction here, because we have a lack of motion, okay? So the way that I like to think about this is anytime you see inflammation or infection, that's a bad thing, okay? So our polarity is going to be negative for that. If there are no indications that there is inflammation or infection present, then we're going to switch it to a positive polarity. Okay, so now let's look at some of the contraindications and information regarding documentation for electrical stimulation. So here are our contraindications and some precautions that we would want to consider before applying any form of electrical stimulation, not just high volt pulse current. So let's take a peek at the left-hand side here. Contraindications first. If somebody has a cardiac pacemaker, then we're not going to apply electrical stimulation. If they have an implanted defibrillator, again, same thing, we're not going to apply that there. If they have any form of unstable arrhythmias, then we're going to be very cautious. We're going to avoid applying any E-Stim there. We're not going to place these electrical pads over the carotid sinus, so on the anterior portion of somebody's neck. This could cause vasodilation of that area and significantly reduce blood pressure and cause fainting episodes. We're not going to place any form of electrical stimulation over venous or arterial thrombosis. So making sure that they do not have any blood clots in the area, DVTs, along those lines. We're going to make sure not to place our electrical stimulation pads over the trunk if somebody is pregnant. We're not trying to stimulate early contractions for that person. We're not trying to induce any labor or anything like that. And malignant tumors is going to be another one where we're going to avoid using electrical stimulation. Some of the precautions may relate to these contraindications, such as cardiac disease. If they have impaired sensation or mentation, we want to be very careful of that. And then if there's any skin irritation or open wounds in the area, again, more of a precaution that we want to take before applying these. Okay? So here's a nice little just example of where you might find a pacemaker or an implantable device. So the left-hand image shows where a pacemaker might be. You could palpate that area if they are unsure if they have a pacemaker or not, which would be pretty rare, I would assume. But you can always go to those certain areas right below the clavicle on that left-hand side and see if they actually have a pacemaker just by palpation. And then just for a little visual, the right-hand image shows where the carotid sinus is. We are not going to place E-Stim pads over that area. Okay, a lot of students always ask me about E-Stim pads on the posterior side of the neck. And I would say that is acceptable, but you just have to be really cautious, okay? So maybe limit how far up you go on that cervical spine area on the posterior side even. Just be really cautious that you're using the correct pad size so that it's not wrapping around anterior onto that carotid sinus. Okay, now some of the adverse effects of electrical currents, and this is just for all of them. Burns is the #1 thing that you need to watch out for. So burns are going to be something that you're going to have to evaluate for after your treatment is over, and just know that there's a higher risk with higher current density or high current or small electrodes, okay? So if you're using really small electrodes, this is something that we talked about in class, there's a higher current density going through those small pads. So you want to be really cautious not to turn the intensity up too high or anything along those lines. And any form of skin impedance that you can eliminate would be best. So make sure that you clean the skin either with an alcohol pad or a damp towel to remove any oils, lotions from the skin, as that can increase skin impedance, and we don't want that. Okay. Skin irritation just from the pads themselves could be a possibility as well. And then pain, some people do not tolerate electrical stimulation very well. So maybe thinking about, what form of electrical current would be best for your patient. Just remember that the sinusoidal wave is going to be more comfortable than something like a symmetrical biphasic wave. So you have to consider the goal of the treatment. If you can choose between a sinusoidal wave or something like IFC or a biphasic wave like you would see in TENS, maybe you'd want to err on the side of caution and go for that sinusoidal wave using IFC. Okay. As far as documentation goes, you're going to definitely try to document all of this information in your SOAP notes. So thinking about the area that you treated, you absolutely need to have that in your documentation. The positioning of the patient, the parameters that you were using, the electrode placement, the duration of the treatment, and of course the response to the intervention. So most of this information is going to be found in your objective section. What did you do on the day of treatment? Anything that you performed should go in your objective section. And then the response to the intervention is something that you're going to see in your assessment portion of your document. And here are some of the CPT codes that we use for electrical stimulation. So you can see that some of these codes are attended and unattended. So let's maybe just take a peek at that first. So CPT code 97014, E-Stim unattended. This could be something like TENS or IFC. This is an untimed code, and we can only bill this one time per session. Okay, so you can set your patient up on IFC and leave them with a call bell, leave them with a kill switch, come back in 10 minutes, and they'll be on their way once you perform your final skin check. A little bit different than what we'd see with our next CPT code 97032, which is E-Stim supervised. So NMES, Russian, high volt pulse current. This is going to be a timed unit, billed in 15-minute increments. You should be there the entire time for this modality. So just an example, if we're treating somebody with, let's say, quadriceps weakness, we need to be there during the on cycle for that 10-second long contraction. We need to be giving them tactile cues, tapping the muscle belly. We need to be supervising that activity, okay? So a little bit different than the unattended E-Stim, which is mainly for pain modulation. Then we get into the CPT code 97033, Iontophoresis. Just remember that we're trying to deliver some form of medication with this particular modality. This is a timed unit and can be billed in 15-minute increments. And then we have our last one, 90901, biofeedback. So looking at voluntary muscle contraction or relaxation. This is another timed unit and again billed in 15-minute increments. So just having a decent understanding of these different CPT codes is going to help you when you get into your clinical rotations. And that concludes our lectures on electrical stimulation. I hope this has been helpful for you all. If you have any questions, feel free to reach out to me directly. And again, thank you for stopping by, listening in. I'll see you on the next video.